Assalamu alaikum and welcome to the show. My name is Shakil Salam, and I have a guest, Dr. Abdul Mannan. He is a GP in Rosendale, and he is with me today talking about Ramadan and health. Assalamu alaikum, doctor.
Walaikum salam, Shakil.
How are you?
I'm fine, thank you.
Ramadan Mubarak.
And to you as well. Ramadan Mubarak to you and to the viewers.
Absolutely.
Yeah.
And Ramadan and health is very important in Ramadan, isn't it?
Absolutely.
So
Absolutely.
let's talk about some of the common health issues
Yeah.
people come across. What are the key things you come across when people in Ramadan come to you and complain about it?
Okay. Common things being common. I got to say most of my patients I come across, a lot of Muslims I come across, we're very good when it comes to adjusting ourselves and preparing and fasting. And even children I come across, they're very, very good at the way they manage themselves. Yeah, a few cases we come across, for example, people struggle with headaches, people struggle with tiredness.
Okay.
And there are a number of other things that you come across, but I would say headaches I come across a lot.
Yeah. Let's talk about headache then.
Yeah.
Why do people get headache during month of Ramadan? What's the causes of it?
Yeah. I would suggest it's probably a number of reasons. Okay. We got to remember for having slept at a certain time throughout the year, we are suddenly having to wake up at night and eat. We are having to stay up later on at night so that we can have our iftar. And there, of course, there's Taraweeh and so forth. So people's sleep and awake cycle has been disturbed. Right?
Just change of the pattern, isn't it? Day-to-day pattern, completely change.
Absolutely. So you've changed your awake and sleep pattern, okay? The other thing you've done is you've stopped eating. You've stopped drinking. For this time of year, it's many hours of the day. So the body, as you know, does need regular nutrition, regular fluids. So in the absence of that, for long periods of time, the body can slowly dry. It dries up. So that can cause headaches as well. So I would say it's change of circumstances. That's probably the main reason why people get headaches.
Okay. And what will be the solution? What is the treatment? How do you persuade these people what they can do to avoid this headache or migraine?
Okay. Well, again, I give my patients a number of tips, perhaps, or advice in terms of how to minimize headaches. I can't honestly say that we can completely eliminate the problem. Some of us are more prone to headaches than other people. And unfortunately, those of us who are more prone to headaches, in Ramadan, we will be a bit more prone to headaches as compared to somebody else, right? Then in terms of minimizing the risk of headaches, let's look at how we prepare for the fast itself.
Okay.
So one of the things I do, for example, is prior to Ramadan coming in, perhaps it's too late for this year, but
it's very late
for,
now.
something
for next year.
Absolutely. What I do is I advise myself and my family, my patients, that one of the things that we're good at is drinking tea and coffee. Would you agree?
Yeah, absolutely.
Yeah. Well, the month before Ramadan, try to cut down on the amount of caffeine you consume, because when we suddenly stop caffeine, tea and coffee, that can cause like a withdrawal effect, which can show itself as headaches. So the month before, for example, I go on decaffeinated coffee.
Okay.
Yeah. I will reduce the overall consumption, how much tea and coffee I have. That helps me. It's helped me a lot in the previous years.
And also you said the pattern of getting up in the morning, eating a different time.
Absolutely.
That upset the system, the routine, day-to-day routine.
Absolutely.
Tiredness, is that one of the cause of headache as well?
Yeah, of course. Of course it is. We mentioned earlier on that you've disturbed your sleep-awake cycle. So that in itself will cause the tiredness. And of course, the main thing we're saying is the headache. So how about leading up to Ramadan, and in Ramadan itself, you pace yourself well. So before Ramadan, try and get used to those hours where you will be awake. where you will need to get some sleep perhaps, and try and practice, try and get into the routine of that before Ramadan.
Okay.
In Ramadan, maximum use and good use of time, right? So when you have time to sleep, so after work, you've gone home, if you can carve out some time so that you can sleep earlier on in the day, great, because then you can spend more time later on at night to do prayers or reading and so forth that people do. In terms of rest and doing physical activity, for example, you might find that doing strenuous activity in Ramadan, you might just have to curtail that slightly, all right? So if especially I come across youngsters who they're used to playing a lot of sports, and in Ramadan I would say, it's not that I would say you don't have to, you can't play or you can't be active,
No.
but you can be a bit more, you can tone it down a bit, can't you?
Absolutely.
Yeah.
Yeah. And this year we are seeing as one of the warmest summer, and Ramadan is probably longest than average.
Absolutely.
Does the warm weather contribute towards your headache and tiredness?
Of course it does. You're talking about conditions outside of the body, which probably beyond our control. Yeah, I suppose the reason I say that is because if you're in an air-conditioned room, you've controlled that environment, haven't you?
Absolutely.
So you're not going to sweat as much. You're not going to be as hot. You're not going to lose as much fluid from the body, and you won't be as tired as a result. And also, you're less likely to get headaches. So perhaps, be careful. Don't go in the sunshine as much. Don't strain yourself in that way as much. Just look after yourself more.
Okay. And take it easy, isn't it? Because Ramadan is going to be, well, it is longest Ramadan we're going to have.
Yeah.
And without food and drink,
Yeah.
it's going to be difficult for some people to manage.
Yeah.
What, 18, 19 hours?
Something like that.
Yeah.
Yeah.
Apart from headache, what other issues people have? What are the key things you come across?
You've actually brought it up. You mentioned tiredness.
Oh, yeah.
So that probably is the other most frequent problem I come across. People are tired. So we've already touched on a couple of things as to how to deal with tiredness, i.e. maybe reduce some of your activity.
Yeah.
Make sure you're not overexposing yourself to too much sun, to hot weather and so forth.
Okay.
Look at the type of work that you do. Can you adjust your work patterns to fit around your fasting, for example? Is it possible to maybe start work slightly later and finish maybe earlier, or as personally I prefer to start slightly late in the day, but I'll finish late in the day, so I just move my work hours. I fully appreciate not everybody can do that.
No, it's not.
Not everybody can do that, so it's not the easiest thing to achieve.
Also, I've noticed, that as day goes on, you're getting thirsty, you're getting hungry, and I also noticed that by lunchtime or afternoon, your span of concentration is affecting, and also because you're getting tired. What was the best advice for people, especially as I said, in the afternoon, when it's all the body has absorbed your food and drink, and you become more hungry? Is it having rest and taking it easy?
Well, you're absolutely right, especially on long days like we are experiencing at the moment. You will start to kind of, as we say, you'll become a bit more droopy. You'll become a bit more tired, a bit more slow towards the middle of the afternoon and later on. It's very important that you pace yourself throughout the day. So have regular breaks. Speak to your employers, speak to colleagues around you, so that you're able to kind of portion your day so that you're doing an amount of work, but then you're able to rest for a few minutes, and then you can start again, and so forth.
Also, when we're talking about changing the pattern, eating very early
Yeah.
and not eating till very late in the evening,
Yeah.
how much impact it has in our digestive system, and what are the issues we can come across in terms of heartburn, looking at constipation, things like that?
Yeah, yeah. I guess the issue you're coming onto now is how fasting can then impact on the body itself. Constipation we come across quite a lot. I think a lot of that is to do with how you prepare for the fast itself. So how do we prepare? Prior to starting your fast, we have a meal at night, sehri. It's very important that we eat the right kind of foods for sehri. For example, we advise that people have, the complex carbohydrates. So things like porridge oats, barley, wheat. There are fruits as well that are slow burning. So, for example, bananas, prunes, figs, and as we all know, the most famous of all, thing we eat in Ramadan is dates, packed full of carbohydrates, minerals, very, very important sources of nutrition. And it's important to eat those kind of foods in preparation for the day, so that the food that you eat doesn't burn off too quickly. Yeah? If, for example, you had biscuits, chocolate bars, foods which kind of work very quickly, they give you a burst of energy, but they don't last long. So can you see how, as the day goes on, you will quickly start to droop?
Absolutely.
You will quickly tire. So it's important eating the right type of food at Sehri time. The other thing I want to touch on is fluids. That, I'm afraid, is not just Sehri time. That starts at Iftari time. Yeah? It's very important to, once you've stopped fasting at Iftar, carry on drinking small but regular amounts, so that you are regularly hydrating yourself. You've only got a few hours, haven't you?
Absolutely.
Between Iftar and Sehri, just a few hours this time of year.
This is it.
So it's important to keep drinking small but regular amounts of fluids, so that by the time you're starting your fast, you've consumed plenty of fluid, so you're as hydrated as possible for the rest of the day.
So when we're talking about fluid, do you specifically mean water or any type of fluid?
That's a good question. That's a good question. Fluid, water is of course very good. Other fluids, soft drinks are good. Fruit juices are fine. However, drinks that are very high in sugar, I would say try and avoid. Yeah, and it's very important if you have conditions like diabetes and so forth as well, that you don't overconsume the sweet drinks. We mentioned coffee and tea earlier. I don't know about you, I love my cup of tea after iftar. So
people do, yeah.
Yeah, brilliant. Nothing wrong with that. But I'd kind of ask you to maybe avoid drinking too much coffee and tea in that time, because whilst it's nice, it can also have an effect on your body. It makes you pass water a lot more. Yeah, it's a weak diuretic. Yeah, and that can dry you a lot more, a lot quicker during the day.
So water is the best, and drink as much as you can from Aftari all the way through Sehri.
Absolutely, absolutely.
Okay, so we talked about food, and that food is important, and because of the change of system, it will affect the way we carry on with life day to day. And it probably take a couple of days for people to get used to that routine, getting up early in the morning. Do you think things get easier as time go along?
I think so. Yeah, I'm sure you'd agree. in the first, I personally find the first day or two, you know, I'm trying to get used to everything. And, you know, it's actually not eating and not doing what you normally do. For example, you'd make a cup of tea or a cup of coffee and you'd have a drink. Not that you need it, but you do it. It's a habit. People who smoke, for example, they'll light a cigarette. It's not necessarily because they have to. It's more, there is a habitual element. And it's breaking that habit in the first few days. I think that's what the main issue is. But once you pass that stage, by day 2 or day 3, I find it gets a lot easier.
Yeah.
You know.
We talked about caffeine and the impact that caffeine has in our mood, our sort of, you know, headache, things like that.
Yeah.
Some of our colleagues who smoke, is there a similar impact on them as well, because they're so used to, and the impact of not smoking for 18 hours is one of the hardest things, isn't it?
It must be extremely difficult. If you think coming off coffee and tea is difficult, well, I actually genuinely feel sorry for people who smoke, because it is an extremely addictive you know, substance that they're used to, the nicotine. And it's not easy.
No.
It's not easy for them at all. I'll have patients saying, "Doctor, you know, the first thing I'm doing when I break my, you know, fast in the evening, when I'm at iftari time, is I need a cigarette," you know, because they're craving, you know. So it's difficult. So how do you prepare? How do you prepare? How do you manage? Again, similar concepts of discussion with these friends and patients I speak to. Start early.
Okay.
Yeah. If you're used to having 20 cigarettes a day, well, the month before Ramadan, start to reduce. Yeah. Try and get used to having maybe 16 a day for a week. Another week, try to get used to 12 a day. Another week, try and get used to 8, and so forth. Bring yourself down slowly before Ramadan, and you know what? And it works. I've done that with patients.
All right.
And we've actually used this as a method to quit smoking.
Okay.
Because, I mean, my argument is, if you can stop yourself from having a cigarette for 18, 20 hours a day, you know, you've weaned yourself almost, I would say, 80, 90%.
Which is a great effort, isn't it? Yeah.
You're there. So wouldn't it be great to use Ramadan as an occasion to actually quit?
And that's very key message. Also, I want to come into another interesting topic which people come across. When we talk about Ramadan, it's spiritual, it's a religious responsibility.
Yeah.
And a lot of people believe, you know, it's very calming, very spiritual thing. People do a lot of prayer, people are nice to each other.
Of course.
But heat, what we're getting now, and also not eating and drinking, and people who smoke don't have to smoke, people who are used to coffee.
I know where this is
Sometimes the
going.
moods can variable, and people can get very frustrated because they're tired. They get very angry and frustrated. Is that a common thing you come across?
I perhaps don't come across that as much as a GP. Why? People, when they come to me, they are, you know, in the main, very polite. They're very nice. So they probably hide that, maybe. But no, as a person, as somebody who has family, who has friends, I see that all the time. I totally agree with you. Ramadan is a time when, because of all the changes to your routine, to your eating, to your drinking, to your sleeping, to your waking, so much going on, and I'm sure this is a time that it's a test for a lot of us. It's difficult, you know, and I suppose that's the whole spirit of Ramadan, to be fighting
Absolutely.
Those negative or aspects of our character which we're trying to control, and so that we become better people. But in that time, it can come out, and we can get angry, and I'm afraid it is true. We become irritable. We can get angry easily. We can lose patience. That's something that does happen.
Absolutely.
Yeah.
Just finally, towards the end of the program, what are the key tips? We talked about some of the common things, possibly in terms of health-related issues.
Yeah.
Just summarize it briefly for us and give key tips to us.
Very important. Eat the right food. Very important. You know, the rich foods that we commonly come across, fried food, you know, your samosas and your kebabs and very heavy food. Try and avoid that. Try and avoid lots of salt. Try and avoid lots of fats. You know, anything in excess, try and avoid.
Okay.
I'm not saying you can't have any. We'll keep it nice and well controlled, in balance. Lots of fruit, lots of veg, the right foods. Lots of what I call complex carbohydrates. You know, your wheats, your oats, your porridge, your basmati, things like that. Plenty of that. Plenty of fluids. Iftar to Sahri, this time, pace yourself, get lots of fluids going. Try to avoid caffeine, you know, small amount, no problem, but not too much. Yeah? Throughout the day, pace yourself, okay? It's not a race, it's more like a marathon, yeah? And the Ramadan itself is a marathon, yeah? 30 days, you need to slowly, inshallah, get there, yeah? So take your time. Take regular breaks, you know, a good way is around your prayers, you know, chop the day into bits. You know, of course, in a long day, you've got a big break between Dhuhr and Asr, for example. Chop it up. Make it like 1.5 hour, 2 hour segments and get breaks. Yeah? Don't spend too much time cooking, for example. Don't spend too much time, you know, doing physical activity. Yeah? Rest. Take it easy, you know, so that you can enjoy Ramadan for what it really is.
Okay. That's some key messages for today. And can I just say thank you very much for coming along and talking to us. It is really important for people to come. Final message for smokers. What is the key message? Just remind us about it. We talked about smoking as well.
As I said, it's a fantastic opportunity to quit smoking. And as a GP, I'm an advocate and I have to use this as an opportunity. And I know it works because I've done it with a number of my patients who have quit in Ramadan, you know. You've come such a long way in Ramadan, you're smoking so much less. You know what? Make it a time to actually stop, because you can do it.
Brilliant. With that note, Dr. Abdul Mannan, thank you very much for coming along and talking to us.
Very welcome.
Can I just say thank you and Ramadan Mubarak.
Ramadan Mubarak to you.
Good.